Hello, and thank you for joining us for another episode of RN Cliff Notes. And today we're talking about neurotransmitters. Now, it's very important that you go and watch previous videos because one of the major neurotransmitters, we're not going to discuss it in this one, we discussed it in the peripheral neurological disorders video. So, we're going to talk about different neurotransmitters. And by the way, for our first question, we're going to ask that you not use the name of the previously talked about neurotransmitter, which was acetylcholine. If you haven't seen that video, go check that out, okay? So, neurotransmitters, additional neurotransmitters, right? So, what are we doing? Well, we're making these videos, helping students to see through larger concepts, right? And as we're seeing through larger concepts, we want to study smart, right? So, I'm Cliff Davis, Associate Dean of Nursing and longtime advanced medical surgical nursing professor. So, on your paper, on your phone, whatever you're using, right? Go ahead and jot down the name of 4 more neurotransmitters, right? So, we're not using acetylcholine in this list. No, okay? So, 4 more that are sent to cause responses in the body, right? And we're giving you a clue with this word. Scent. What are they? Write those down. If you can't think of them, shame. That's all right. You're here to learn, right? Okay? So, here we go. We use the word scent, right? I know, yeah, T, a D, it's different. That's okay. All right, send. So, neurotransmitters send messages. They are chemicals that are sent to perform, right, responses in the body. So we've got S, serotonin, we've got E, epinephrine, and then norepinephrine, its buddy in the fight or flight response, and then dopamine, right? So 4 additional neurotransmitters that you need to know about. And these are going to play a key role when we start to segue into cardiac discussions. So, got to talk about these neurotransmitters and how they function. All right. Now, what do they do? So, bear in mind what they do. And as a part of our Study Smart strategy, we teach you to work with the letters and the numbers. So, the letters in this case, serotonin, it plays a role in terms of sadness. If you don't have a high enough level of serotonin, you tend to be in a sad type of mood, right? So that's how that neurotransmitter functions. Then we have epinephrine. That's the one that's activated in an emergency, right? And we talked about fight or flight. So epi, E, emergency. And then a little bit of wordplay here to squeeze in norepinephrine. What does norepinephrine do? It intensifies blood pressure, as we're going to see. Intensifies blood pressure. Then dopamine, that's the one that helps us with dexterity. When we say dexterity, we're speaking of what? Fine motor control. Yes. Alrighty. So, as we progress on. So, serotonin was our first one. So, as we said, it impacts mood. Sadness occurs when you have serotonin at low levels. However, right, you want to be cautious because serotonin at toxic levels can cause serotonin syndrome. And we've got a picture of that. So some things that are happening here, you can't see the print. But to make that larger, here's what we're going to do. We're going to use the acronym Shivers. Shivers. All right, as someone posted, this is great stuff. What I changed here is this E for eye dilation. Yeah, that's a more important E in my opinion. So shivers, when you see a person with serotonin toxicity or serotonin syndrome. So they're going to be what? Shivering. And hyperreflexia, that fits right in that shivering picture. And increased temperature, okay? And also their vital signs are unstable. And they have eye dilation. So eye dilation. So with eye dilation, you see this term thrown out called mydriasis. Mydriasis is just a fancy term for referring to eye dilation. Then restlessness, sweating, diaphoresis, you know what I mean? We like to have a term for that that spice things up. So sweating, diaphoresis, so shivers. All right, epinephrine, so our fight or flight neurotransmitter. And we want to break this down to you. So we tend to find our epinephrine, right, where our kidneys are and in this gland. So on your paper, write down the name of that gland. What's that gland up there? So go ahead and jot that down, right? And that is your adrenal gland, by the way. And what I want to do is break down to you what epinephrine means. People throw that term around a lot. Epinephrine, adrenaline, right? And they really don't understand where it actually comes from. So here goes. Epi, as we understand from our studies of anatomy, means on top of something, right? So we see that the adrenal gland is what? On top of the kidney. So that yellow area on top of the kidney, almost like a hat to the kidney, right? Added to the top of the kidney. And when we say nephro, we're talking about kidney. And then in epinephrine, what is it saying? I live, or I come from, on top of the kidneys, right? Yeah. So we throw that out and we make it just a fancy word, and it's just like, oh, epinephrine, like it's something, you know, some kind of separate special drug, but its name tells you its point of origin, where it's actually manufactured in the body. So sometimes we see these chemicals and we think laboratory, somebody made it in a lab. Well, your body manufactures this, and the name itself tells you its point of origin, where it's actually made, right? On top of the kidneys, okay? Now, its other name. So if you know the other name for epinephrine, write that down, okay? And you probably guessed it by now, right? Yeah, so what is it? It is adrenaline. Okay, but now you can see it, right? So what's going on? It's saying that I am from the thing that is what? Added to the renal limb. Added to the top of the renal, right? So whether you say epinephrine, right? I come from on top of the kidney, or I'm the chemical that what? Is added to the renal, added to the top of the renal, added to the top of the kidney. Adrenaline or epinephrine. Yes? Excellent. Okay. Now, when we're talking about epinephrine, keeping that theme of like having too much going on, there is a condition that your patients can have where they're suffering from what we call a pheochromocytoma. Pheochromocytomas cause hypertension. They're an overactive, right? I got a little carried away with that guy. Ready? Making muscles and stuff. Okay, anyway. So, right? So whenever there's an oma, right, there's some kind of growth or a tumor. But don't let the word or the suffix oma throw you. That doesn't mean malignancy, right? There's just some type of tumor or growth in there that, you know, shouldn't be there. So a pheochromocytoma specifically is the type that grows inside of your adrenal glands or really close to your adrenal glands and sort of forces your adrenal gland, or it itself produces entirely more or too much epinephrine or adrenaline than your body needed. And as a response, what happens? The patient suffers from hypertension. Seems like we can't correct it, right? Why? Because they have a pheochromocytoma. All right, good. Overactive adrenal gland because of a growth. All right, what are the primary receptors in the circulatory system? So go ahead and write those down. If you don't know them, then shame. Don't worry about it. All right, you're about to know them like that. You know what I mean? Why? Because you're watching Orange Cliff Notes. That's why. Right? So, all right. What are the primary receptors in the circulatory system? Here's the easy, breezy way to know it. Right? Check this out. So, all right. As we were coming up, what did we learn? Right? Grade school, we learned the alphabet. So with alphabet, here's what we're going to do with that when it comes to the receptors in the circulatory system, right? We're going to realize that alphabet is what? Short for alpha beta. Alphabet, alpha beta. And those are the two types of receptors that we're concerned with. And when we're speaking to those receptors, you have alpha 1, alpha 2, B1, and B2. Not hard. Alpha 1, alpha 2, beta 1, beta 2. And we're going to get into how they break down. And we're still going to work with those letters, right? Because that's our thing. So, here we go. When we're talking about alpha 1, we're talking about, right? We're talking about receptors that are in the arterial muscle wall, the smooth muscle from arteries. And now just imagine that if that hadn't registered with you yet, right? Arteries are really muscular. They are so much more muscular than veins. So lots of muscle, and if that muscle relax, then your heart doesn't have to pump as hard to send blood to your body's system. And by the way, that's why we call systolic, that top number, that's why we refer to that as systolic. What's happening? Your heart's pumping blood to what? The body system, okay? Systolic. And your systolic pressure wouldn't be as high if your arterial muscle walls, the smooth muscle, would just relax, okay? So alpha 1, that's what that hits. All right, alpha 2, the same thing. And I want you to notice, 2, what? There's 2 more things. So it also impacts the arterial muscle wall, but there's 2 more things about it, right? Because it's alpha what? 2. And the 2 additional things is that it's found in the liver cells in the body. It's also found on platelets, right? Good. Then we move to the betas. And beta 1, what's the big 1? The big important 1 in your body? Your heart, right? So the big 1, beta 1, those receptors are found in your heart. And then B2, just like A2, what? 2 additional things, right? But this is more specific this time. So not so much not in the heart, but we're looking at beta 2 and bronchioles, and in terms of blood vessels in your muscles, in your actual muscles, right? Your biceps, your triceps, the arteries that are circulating blood within those muscles, not necessarily the rest of the system. So bronchioles and blood vessels in the muscles, okay? And now, if we go a little further here, just to give you the picture aspect so that you can see that too, right? So what we've got alpha 1 and 2, what did we say? They affect the smooth muscle in the artery. So we got a picture of an artery there. And then your beta 1, right? Your beta 1 receptors, they're found where? In the heart. Beta 2, we know, are found in the bronchioles, as well as they're the arterial circulation in your muscles, in your body, in your musculature, right? So alpha 1 and 2, beta 1 and 2. All right? Great. Now, we want to talk about norepinephrine. Because we've talked about serotonin, we talked about epi, and as we're completing that word sin, right? Next will be norepinephrine. And norepinephrine is a vasopressor. But now, again, let's dissect the word because we want to know. We came here to learn, right? When we say vaso, we're referring to what? Vessels. Vaso. And then what? It's affecting what? The pressure inside of there. So when we see vasopressor, that shouldn't be a word. It's like, oh man, what does that mean? It's like, it's telling you what it means. Vessel, what? Pressure. So a vessel pressure medication by the name of Levophed. It's our other name for norepinephrine. So we're giving that to patients who have hypotension. And you know what? That's the thing there. Just that right there. Hypotension. Why? We normally don't talk about that. We're so busy talking about hypertension. Cut back on your salt. Change your diet. Hypertension. Because that's like, a bigger societal problem. However, some people suffer from hypotension, and sometimes it's bad to the point where they need supplemental doses to help bring their pressure up. So this is given IV and acts on both. We learned these guys, right? Alpha 1 and alpha 2, which impacted the patient's what? Vessels, the muscles in the vessels. That's where those receptors were located that we learned about, right? So those adrenergic receptors cause vasoconstriction. Yeah. All right. But now, before we move our slide, again, words. Adrenergic. We see what? Adrenals, which we just learned about, those guys, right? That's where the adrenaline comes from, or the epi comes from. And in the case of norepinephrine, what does it do? Cause vasoconstriction, and that's going to boost up your patient's blood pressure by squeezing on their limbs, right? Squeezing down on those vessels on their limbs and bringing their central blood pressure up. However, there are limits to that, because we can go too far with that vasoconstriction thing, right? As we're attempting to bring up the patient's blood pressure, and if we don't watch it, especially if we mix too many vasoconstrictors or vasopressors together, our patients could suffer in terms of not being able to have enough circulation to their appendages, to their fingers, right? So, while we were out to bring up their blood pressure, we didn't realize that we could cause them to lose their fingers. So, we can take that vasoconstriction, right, as we're trying to boost the blood pressure, we could take that too far. So, be cautious. All right, now, so we did the serotonin, the epi, right? The norepinephrine, and then now it's time to talk about the dopamine. And dopamine, we connected dopamine by letters to dexterity. But we're going to do another thing, right? In terms of our study smart. We're going to, right? We're going to rotate that letter D and turn it into a P for Parkinsonianism, right? Why? This is one of our main medications that we need in terms of levodopa, right? You see your patients, they got levodopa, carbidopa that you're needing to give that to, and for some of you that are already nurses, right? And what's that going to do? Because it helps with dexterity, it's going to help reduce or eliminate our patients' fine motor tremors, right? You have some patients, their tremors are so bad that they can't sign their name clearly, right? But then maybe if we give them dopamine, their dexterity would improve and they would be able to accomplish that task. Okay? So, by the way, we want to add something to this, something that you tend to see on tests. So you've got a patient with Parkinsonianism, right? So their hand may shake like that. One of the things that we describe is sometimes you see them doing this with their fingers. What do we call that? Write it down if you know the name of it. What is that sign? It's very specific. That sign is pill rolling. We refer to that motion, right? Those tremors, that tremor-like motion is pill rolling. The other thing we see those patients with is, what do we call it? A shuffling gait. So pill rolling and a shuffling gait, right? Are some of the signs that we see with patients with Parkinsonianism. Okay, so now, on your paper again. So, go down that list. What were the 4 that we learned about today? And here, let's add a bonus, because that's too easy. Isn't that right? Too daggone easy. So, give me those 4 neurotransmitters, and you know what? Why don't we have you give us the 4 receptors that we learned about as well? And for those who are really paying attention, where do we find those receptors? Go for it. Okay? And, right? So our 4 neurotransmitters, let's just back up. What were they again? Serotonin, epi, norepinephrine, and the last one that we just saw, dopamine. But as we go back up, and we found out that we added this on here, we've got arterial muscle, That's where we find alpha 1. Alpha 2, we found it also in the arterial muscle wall, in the smooth muscle, but we also found it on liver cells, and we found it on platelets. 2 more things, right? And for the betas, that was beta 1, what? The big one, the big important one, what? The heart. And we've got the 2 more things, what? Bronchioles and the blood vessels. For beta 2 here, what? In the bronchioles and the blood vessels, specifically inside of your skeletal muscles in your body. Okay? And we remember that using alphabet. Alpha, beta. All right. Well, hey, good job, guys. I want to thank you all for tuning in. And again, continue to study smart. All right? Thanks.